Hi, thank you so much for joining us again on the next episode of the APV podcast. My name is Kiara Ferguson and I am your host. And today I have the pleasure of having Dr. Andrew Schuman here with me. He is a clinical assistant professor of pediatrics at the Geisel School of Medicine at Dartmouth, a member of the editorial advisory board for the Contemporary Pediatrics Journal, the project director of the New Hampshire Amblyopia Project, the CEO of Medgizmos medical technology review site, and also a board member here at the Association for Pediatric Vision. I'm so happy to have you here today, Dr. Schuman. Thank you for joining us. And I'm going to give you a moment just to introduce yourself.
Okay, well, Kira, thank you so much for inviting me. I think you did a great job telling folks my credentials, but most importantly, I've been a pediatrician forever, and I think I'm over 40 years at this point. And
Oh, wow.
I really like pediatrics. I like taking care of families. So I was in private practice for 20 years, and now I work in a clinic at a Dartmouth facility in Nashua, New Hampshire. And I've been very interested over the years in screening kids for a variety of problems. As with most physicians, I'm very frustrated with a lot of aspects of healthcare. There's a big disparity in how kids get screened and
Right.
referred for specialty services. A lot is dependent on insurance coverage, a lot of roadblocks to providing the best care for kids. So uh, I've been very much involved in screening kids for hearing problems. I started the first newborn hearing screening program back in 1996 in the state of New Hampshire. We've
Wow.
come a long way with newborn hearing screening. But despite the fact that we do vision screening in kids, there are still too many kids who either are not screened or if they refer on screening, never get to see a optometrist or ophthalmologist so they can be diagnosed and treated for amblyopia. And
Right.
we'll get into that in a little bit.
Right. Well, thank you so much for being here again, Dr. Schuman. I am so excited to have this conversation and for everyone to learn a little bit more about the topic at hand, which brings me into our topic, which is going to be the importance of arranging follow-up and diagnostics exams for kids who are referred. So a child that is referred, what exactly does that mean? What is a referral?
So we should talk a little bit about the basics of vision screening for children and how screening has evolved over the years. So going back 20 years ago, the only way we had to screen was with vision charts, and
Mhm.
you needed a cooperative child to either be able to identify letters or show you the position of, identify objects on a vision chart or point in the direction of the tumbling E's that indicate where the E is pointing. So that's
Right.
what we had many decades ago. Eventually, technologies were developed. These are vision screeners, uh, such as the plus optics and spot vision screeners. They're photorefractors, and
Right.
they can test for alignment of the eyes, and they've created the ability to test younger kids as young as 1 or 2 years of age for vision problems.
Right.
It took a long time for the Academy of Pediatrics and ophthalmologic associations to acknowledge that it's good to identify problems at a young age and get kids seen by eye professionals. So a diagnosis can be made, and intervention can be done at an early age. So
Right.
that is now an improved and accepted technology. But unfortunately, only a third of pediatricians, from what I understand, are actually doing refractive vision screening in their offices. There are screening done in school systems, sometimes in daycares, sometimes by volunteers. So the big statistics that people should acknowledge and know about is that uh, only 40% of children have been screened even once by age 5 years of age.
Wow.
So screening is a big part of identifying a problem. But the other big issue is that about half of those kids who need to have a diagnostic exam do not get a diagnostic exam. And there's a variety of reasons for that. Uh, if someone has deafness, congenital hearing loss, or an acquired hearing loss, then it's very obvious. A child doesn't speak at appropriate times, and it's fairly easy to identify with current technology, either at birth or as a child gets older.
Right.
Parents can understand what deafness is and its potential impact on the development of the child. Amblyopia and its impact on vision is complicated. It's hard for a parent to understand it. It's hard for a pediatrician to explain it. And so it's really a brain problem where the child doesn't see equally in both eyes. And if left undiagnosed and untreated, that child can have a permanent vision loss that is uncorrectable. Impacts the potential of the child to do well in school. It has an economic impact because those kids notoriously don't do well economically. There's a lot of obstacles to getting kids a diagnostic exam. There's an understanding on the part of the parent to understand the need. And at some level, it's the fault of the pediatrician for not explaining it well enough to convince the parent that it's so important to get the follow-up diagnostic exam. There are insurance barriers to care. In many states, ophthalmologists cannot afford to do diagnostic exams because the reimbursement from Medicaid is anywhere from a third to half of that provided by standard private insurances.
Wow.
So it is generally recommended that a child get treated by a optometrist or ophthalmologist before 7 years of age. After that, the child will have a permanent vision loss. It's a general statement. There are a lot of nuances
Right.
involved.
Wow. Well, that is definitely a lot of information to take in. I mean, that is such a huge statistic that, 40% of children aren't seen and they're not getting screened. And, that knowledge of what a vision screening is and the importance of it, but not only that, the importance of follow-up care, and getting your child into a doctor's hands after they've received that, negative vision screening result. Um, so after receiving that result, what would you say is a parent's next step if they have their child come home from school, and their child has failed the screening? What should they do
Mhm.
next?
So there should be some communication on the part of the screener directly to the parent, telling the parent about the importance of getting their child seen by an eye professional.
Right.
But there are roadblocks to that because, as I said, a lot of insurances don't cover a child who failed a vision screening. It's just not covered by insurances, which is a shame. So you've got to know the nuances of getting a child screened. So the way I've learned to circumnavigate the insurance companies, you have to use certain language. You have to not use the term failed vision screen. You have to use the term amblyopia suspect, which has a
Mm,
certain diagnostic code to qualify the kid by most insurances to be seen for the evaluation. And it's such a little thing, but parents can get frustrated. They don't understand that it's a necessary thing to have the child undergo a diagnostic exam. Because we are very cautious and kind to parents, we don't we choose our words carefully. We say it's
Right,
important, but we don't use the words your child may be blind if your child doesn't get to be seen.
right,
So while that's strong language, perhaps we need to consider using that type of language to motivate parents to follow up. And like pediatricians and others, we are very frustrated with the many roadblocks that stand between the child and a diagnostic exam and treatment.
right. Well, Dr. Schuman, I thank you so much for your time and for sitting with us and explaining that, what the importance is and why it is so special to get your child to follow up care if you have the opportunity and the resources. But even if you don't, those ways that you can get around that to make sure that your child is ultimately receiving the best care and the care that all kids deserve. With that being said, are there any following, or I'm sorry, tips that you want to leave us with regarding eye care, vision screening, and anything of that regard?
Yeah, so it's kind of interesting in that even if you do vision screening in a busy clinic, it's wrong to assume that a patient gets the follow-up care that we recommend to parents. I did a survey, I believe it was in 2016.
Mhm.
We do vision screening using a plus optics device on every child 2 years and older until age 7. And I was keeping track of the numbers and going through 1,000 charts, which took considerable time, and discovered that of the kids that referred, the kids that actually made it to the eye doctor was 20%. So we talk about 50%, but in some situations, it's a lot less than that.
Right,
So I launched a study to try and improve that number. Unfortunately, there was a pandemic that stood in between uh, us and starting a project. So interestingly enough, I recruited the New Hampshire uh, chapter of the AAP and the New Hampshire Optometric Association to cooperate and try and get kids in. And we determined there were enough qualified optometrists who would take Medicaid. And we learned that we had to use the referral, excuse me, criteria of amblyopia suspect to get them seen.
right,
Even so, there was a problem in getting follow-up. So my thought was that before a patient leaves the office after referral, a communication needs to take part between the office and the vision screening office where an appointment is made. So a parent has an appointment to see an eye professional before they leave the pediatric office. And I won't bore our listeners with details, but there were a lot of problems due to the pandemic and staffing issues. But long story short, you're much more likely to get a child seen for a diagnostic exam if a parent has an appointment in hand and there's communication on the part of the vision screening office and the referring provider. So no child is lost to follow up. So I've started the New Hampshire Amblyopia Project to encourage this, to educate pediatricians and vision screening professionals and parents. So at this point, I have been promised by two state legislators that they will put forth a vision screening bill in New Hampshire
oh wow,
that will increase the reimbursement for Medicaid for follow-up eye care for kids to the level of Medicare. So it will no doubt have an impact on the number of vision professionals who can care for kids. And I'm hoping to also encourage the development of a registry. A registry is important because once a child is screened, then you tell the parent, that the child needs to be seen, and there's nothing else that can be done. Because we know parents move around, households change, parents get divorced. But if you actually keep a list centrally, maybe with the public, with the Department of Health, and keep track of these, no matter who does the screening, we have a list of kids who need diagnostic exams, then a lot can be done to facilitate a diagnostic exam and follow-up. And I think that's the way to go in the future. So it's not just screening, it's really the diagnostic exam that is critical. In fact, if you just do screening, you identify a lot of kids, we should feel bad that a child doesn't make it to a diagnostic exam where they can actually get their vision problem corrected so they don't have permanent vision loss in one or both eyes.
Right. Well, Dr. Schuman, again, we thank you so much for taking the time out to sit with us here today. And I'm going to let that be the end of our podcast. We are going to wrap up. Definitely thank you again, Dr. Schuman, for joining us. Stay tuned for more podcasts coming soon on our YouTube channel, and follow us on Facebook at My Association for Pediatric Vision, and check out our website, myapv.org. Thank you, and have a great rest of your day.